Hello, everyone. My name is Carolina Fernandez. I'm the FCEP Medical Student Council Secretary Editor, and today I'm here with Dr. Lebowitz from UCF HCA Healthcare Emergency Medicine Residency of Greater Orlando at Osceola Regional Medical Center. And I'm going to be talking to him and conducting one of our interviews as part of our program director series. So if you can go ahead and introduce yourself and tell us a little bit about your program or where you're representing.
Sure. Well, thank you so much for having me here. And I'm a big fan of FCEP. I currently serve on the board of directors, and I'm excited to participate in this. So again, my name is David Lebowitz, and I'm the program director of the University of Central Florida HCA Florida Healthcare Greater Orlando Osceola Emergency Medicine Residency Program. I've been with the program for almost 10 years, and we're a program that started in 2016, and we have currently we're approved for 9 residents per year. We used to be 7 residents per year, but we've recently grown to now 9 residents per year. So we're still on the smaller side of programs. And we're really, I like to describe us as a dynamic, high volume, community, academic hybrid program that really values excellence in clinical care, education, and resident well-being, all while maintaining a very fun, supportive culture grounded in what we call magic. And it stands for the M stands for mentorship, the A stands for advocacy, the G stands for grit, the I stands for innovation, and the C stands for community. I guess if I was to really describe 3 elements that sets us apart. It's our clinical population. We care for a very high acuity patient population, and our residents really practice in an unopposed environment, meaning there's not a lot of competition from other specialties like orthopedics or anesthesia. The second thing is that we're really innovative when it comes to medical education and simulation. I'm obsessed with just engaging, interactive, and fun education. Our didactic J's are like just a blast. We have a ton of gamification and simulation, and we're nationally known for our creativity in medical education. And we regularly publish and present this work on a national scale. And well-being, which I hope we'll talk about later, is really a core driver of how we run this program, and it's near and dear to my heart, and truly just like baked into our culture here.
Well, thank you so much for giving that introduction and telling us all about your program. It seems like it has a lot of unique elements with the simulations that you have your residents do and all the different opportunities available and the patient population and also just the academic opportunities that you described as well. I'm gonna go in and ask you a couple more detailed questions and kind of pinpointing at all the specific things like wellness and everything like that. But before we do that, I wanted to first start off with a couple of fun icebreaker questions just to get to know you a little bit
Sure.
better.
Sure.
um, so what would be your go-to song in karaoke?
Well, if you ask my residents, well, first of all, we love karaoke in the residency program. So if you love singing, this is a great program for you. Um, for whatever reason, my recent go-to karaoke anthem would be, believe it or not, "Wrecking Ball" by Miley Cyrus. Have you heard of it?
Yeah, of course.
Uh, I do. I make it a whole dramatic situation. My movements, my dance to it. It's a whole thing. It might be somewhere on social media somewhere. I'm not sure, but I've been told it is. So you could probably find it. But yeah, that's my go-to karaoke song right now.
That's a tough one. I mean, it requires some like pretty good like vocals, and I just that's a tough one to sing.
Yeah, you got to have a good range. We do have a singing elective in our program to help you for our karaoke outings. So if you come to our program, you could enroll in it.
Okay.
Just joking around, but
All right. And then the next one that I wanted to ask is if you had to eat one thing for the rest of your life, one specific food or meal, what would it be?
With no hesitation, it would definitely be pizza. I just love pizza. I'm from New York. We had pizza places like on every corner. And I'm sure many of you know, there's nothing like New York pizza. I could literally eat it for breakfast, lunch, dinner, any time of the day. So definitely pizza.
Yeah. And in New York, you could get the dollar slice, which is pretty nice, or like $2
Yep, yep.
slices. So that's pretty quick meal you can get. Okay. So now I'm just gonna go in and just go straight into asking you a couple more questions about your program. Now is the time where a lot of students are doing away rotations prior to applying a residency. How would you say that these fourth year applicants can stand out to you during their audition rotations with you?
Yeah, great question. And first of all, if just to put a plug out there, if you're currently a student and are in need of an emergency medicine rotation, feel free to reach out to me. It's my name, David period Lebowitz at ucf.edu. Um, and you can also apply to our program via a program called Clinician Nexus.
Mhm.
But to answer your question, how can you stand out? Um, to me, it's just really simple. Just be yourself, be kind, be helpful. A lot of us as program directors and just our residents and faculty, we're looking for team players who are just engaged, eager to learn, and make those around them better. It's honestly, if you're just normal and it's a nice human being, I think that's just the most important thing. If you really want to take it a step up, I would try to really prepare by knowing some of the bread and butter, you know, presentations of emergency medicine, like know how to treat and know how to know the differentials for like chest pain and the life-threatening differentials for headache and back pain, and make sure you know sepsis, stroke, know how to manage trauma patients. I think if you just start with that and become experts on those subjects, you'll really stand out because we really look at your plans.
Mhm.
So you present your patient, and then we look at your differentials and plans. And so if you have a really good, solid differentials and plan and think worst first, and on top of that, have it just be a normal, kind human being, you'll I think you'll be very successful. And I will say, like EMRA has really amazing resources. Um, and so if you just Google EMRA medical student resources or medical student presentation, they have a great like infographic on how to give a succinct but at the same time detailed emergency medicine presentation. And because again, you're oftentimes assessed on that.
Mhm. Okay, yeah, I think that's great advice. I think that, just putting your best foot forward, but also trying to prepare as much is also helpful, especially when formulating like plans is like one of the hardest things for
Mhm.
students after like gathering like the history and presenting. That's something that can always be worked on. And then just transitioning from a rotating student to a resident, what would you say a successful resident at your program looks like?
Yeah, sure. Well, I will say I think that when I think back to my experience going from that transition from a fourth year medical student to a resident, it was probably some of the hardest transitions of my life. It's medical school does a great job to give you the foundation, but nothing really prepares you for that moment that you're now an actual doctor. It was a lot, and it was really tough for me the first few months. Um, I would say a successful resident for me is someone who's compassionate, who's adaptable, who is team oriented, especially for emergency medicine. That's so important. They are ones that really like advocate for their patients and lift up those around them, their peers, embrace feedback because that's how you learn and that's how you grow, and stay just as driven as possible. Residencies like if you do a 3 or 4 year program, that's your 3 to 4 years where you get to really master the specialty. So really putting your all into it. And I think bonus points if they could laugh at themselves and have this keep the mood light and have some humility and humor that goes such a long way.
Mhm. Okay. Um, and then in regards to, residency is very difficult. It's very demanding, with the workload and the hours. How would you say that your program promotes wellness and supporting the residents during the transition of residency and like the tough moments that come along with it?
Yeah, absolutely. I think that residency is a very stressful time for those that are going through it, and emergency medicine. Although I love it, and I'm so glad that I chose the specialty. It's still a very very challenging specialty. Um, in our program, we really focus on meaningful wellness, and although we do a lot of social events and team building and bonding. The research really shows that there's four pillars that are tied to resident well-being and happiness. And so we really focus on those four pillars in the program, and and thankfully they go by the ABCDs, like we do in emergency medicine, airway, breathing, circulation, disability. Well, for well-being, it's A is autonomy. And so that's probably one of the biggest drivers of resident wellness is having autonomy. And it's not having like loose supervision. You're still being guided, but it's where you really um, endorse the decisions that are made in the program, and also that you have decision making when you're working clinically too, and that you have a voice. And so in our program, autonomy is huge, not just in the clinical setting, but also our residents have a voice in the program as well. The B stands for belonging. And so we really support one another in this program. We're there for one another. All our residents have mentors that mentor them and help them grow. The C is competency. And like I mentioned before, I felt so incompetent when I was a first year resident. I didn't know what I was doing. It was just again overwhelming. And so that's really tied to a lot of burnout is feeling like you don't know what you're doing and you feel incompetent. And so in our program, feedback is critical. And one way to combat that feeling of not being competent is to give you high quality verbal feedback. And so that's huge for us, is verbal and written feedback. And really demonstrating to you how much you've grown and how you're progressing and how you are learning every shift. And then last is deep meaning. And this is like so important to me because I feel and I see in emergency medicine, oftentimes we don't realize that we have such an amazing impact on our patients and on society. I can't think of any other career where you have such uh, life-saving, literally life-saving impact.
Mm.
Uh, and so we voice that on shift and we say it out loud like, wow, you just saved this person's life. This young mother of three children almost died, and you recognize that the patient had a pulmonary embolism and you were able to give them life-saving treatment,
Mm.
for example.
Mm.
So we really talk a lot about that on shift and also even outside of shift as well. We've invited patients back to speak to the residency program to discuss their experience and to thank our residents for improving their lives, to really promote that because when you do emergency medicine every day, it feels like you're not, sometimes it might not feel like you're having an impact, but what you do, as they say on MRAP, my favorite podcast, what you do matters.
Mm. Yeah, thank you. Thank you so much for sharing all that insight and all that you do to promote wellness. Yeah, I think it is really important, like what you had mentioned, that it's kind of like the day to day is difficult to see that impact, but when you really think about and reflect, you really see, how much of a difference you're making, and that helps offset, I think, some of the burnout. Um, I did want to go ahead and ask a little bit. I know that you had mentioned it when you were introducing your program, but I wanted to get a better idea about the patient population that your program encounters. Um, I guess like the type of patients that you see, as well as the acuity and the pathology. If you could tell me a little bit more about that.
Sure. Yeah, I'm really proud of the patient population that we serve. We are a very busy level 2 trauma center, comprehensive stroke center, STEMI center. So we basically have almost everything here. And we really care for just a very underserved population. Some of our patients don't really have a lot of access to care here. We also take care of tourists that come, to visit Orlando and the theme parks. Then we take care of just very complex, critically ill patients that as well. So we're really, again, like the safety net for this region. And and again, what's especially I guess, cool for our program is that our residents practice in an unopposed setting. Our hospital is a teaching hospital, but it's a relatively newer teaching hospital, so we don't have a lot of other residency programs. We don't have orthopedic residents, anesthesia residents, ENT residents, plastic residents, trauma fellows. So they really get to do a lot. And even though we're a level 2 trauma center, we still see the sickest of the sick traumas. And again, since we don't have a lot of other residency programs, our residents get to be more involved. So which I think is real important for making sure that our residents are prepared for after residency. So yeah, I love our patient population. They're great. They're very thankful and appreciative. So I really love the hospital that I work at.
Mm. Yeah. And going off of that, I did want to also ask, would you say a lot of your residents stay on as attendings, or how does that, do you have attendings that trained at your program, or would you say a lot of residents go on to pursue fellowships elsewhere or practice elsewhere? Kind of how does that look?
Yeah, great question. To answer your question about whether they stay with us, yeah, we've had quite a few of our residents stay with us, which is so awesome to see them grow from some of them from student to resident, and then to attending. Um, we have several that have stayed with us as attendings. We also have, I forgot to mention, we have 4 fellowships with us. We have a ultrasound fellowship, a EMS fellowship, a medical education fellowship, and a simulation fellowship. So we often have residents that stay on for fellowship, and then they'll stay on after sometimes or go elsewhere. Our associate medical director for the ED is one of our graduates and was one of our chief residents. But from an alumni standpoint, our residents really go anywhere. We have like awesome alumni that are leaders in emergency medicine. We have those that work in California and are medical directors, and others that are core faculty, others that are simulation directors. I have one that's a sim director at Brown University. We have one that's a sim director locally at Advent Health. We have one that's a sim director at UC Irvine. We have clerkship directors in South Florida, where you're at. And so we have alumni spread all over the globe, EMS directors, and again, many different roles in many different health systems and university settings and all different settings. So I'm really proud. Our alumni have done amazing. And we have others that are just not just, but they're in the community setting and doing an amazing job working clinically in the EDs. So you can really go anywhere from our program. We're an academic community hybrid. So if you love academics, many of our residents go into fellowships, but many of our residents also go into the community setting because we really prepare you for anything. We have so much support. We're with the University of Central Florida. We do a ton of research. I mentioned our really innovative education. So if you want to go into fellowships and go into academics, we have that support. We have faculty experts that can mentor you. But if you want to go into community, because we have such a diverse patient population and you work in such an unopposed setting, you'll be prepared for any ED setting in the country.
Yeah, thank you for sharing that as well. Yeah, it seems that there's something that it could pique the interest for any applicant if they're more interested in, I guess, whatever their long-term goals are. There seems like there's something for everyone. I did want to ask this other specific question now. Emergency medicine is one of those residencies that I think allows the flexibility due to the shift work for moonlighting, and it's something that a lot of has piqued a lot of interest in applicants, seeing which programs have offer that the ability to moonlight. Does your program offer that? And if so, kind of how does that look like? And then during at what point in their residency are they allowed to pursue that?
Yeah, we definitely allow moonlighting here. We allow it for third year residents.
Mhm.
We're quite supportive of it, as long as I always tell the residents, as long as it doesn't interfere with like your well-being. But I will say, we have a lot of flexibility in our schedule, so residents in the past have been able to do it. We there's we do have moonlighting, or we have had moonlighting opportunities internally where you could work in like our low acuity zone. It was put on hold for a little bit, but we're bringing that back. So we'll keep everyone updated in that. If you're interested, you can always reach out to me. And then we're also working on getting some more external moonlighting opportunities as well. But yes, we allow moonlighting, and our residents have moonlighted. Many of our residents have moonlighted in the past, and have really enjoyed it.
Mhm. Okay. And then going off of that, I did want to ask if I know you've been with the program for a while, and I wanted to know if there's any new changes or if you're planning anything in specific, anything new for the upcoming year. And if you could tell me a little bit about that.
Sure. So I think our biggest change is that we used to be a residency program with just 7 residents per year, quite a small program. And we cautiously increased the residency to 9. This is our first class coming in July, will be a class of 9, and then we're slowly every year growing it to the 9.
Mhm.
So that's our biggest change, and we've hired more faculty to help support that. So that's a huge change for us, and we're very excited about that. Other than that, we're always making small changes to really enhance the program. Sometimes there's small schedule changes, sometimes there are rotational changes. We actually just had every year we do a retreat, but our retreat's really special because we make it also not just fun, but we also add uh, an evaluation component. So we have our annual program evaluation as well during this retreat, where we have every resident, all the faculty, the ED leaders as well, and we split every resident up in different small groups, and they get to work on different components of the program, and they talk about what's working and maybe what could be improved. And so we're going through that data now on elements that we could change in the program. And we do this every year to help make the program the best it could be and help meet the needs of the residents.
Mhm. Yeah, it's good to always that you're always trying to implement changes and try to make the program as best as it can be every year. Um,
Yeah.
I did want to ask one of the last few questions before we wrap up. With, I know we did talk a little bit about what you were looking for in candidates when they're doing their away rotations, and kind of how a successful resident at your program looks like. We discussed that, but I wanted to ask in particular for individuals applying to your residency program this upcoming cycle, what is something that you say stands out, or what's something that you look for in a candidate for your program?
Yes, great question. I mean, for me, it's quite simple. We're looking for residents who are kind, curious, have grit, really have that magic that we talked about in the beginning.
Mhm.
And we really want residents who just love emergency medicine and support their team, and care deeply about their patients. Have that compassion and empathy that's just so critical in emergency medicine. You don't have to be perfect. So, we just want residents who want to grow, want to learn, um, and are just true team players.
Mhm.
Yeah. So it's not rocket science. We just want just good-hearted, kind, compassionate, and empathetic people.
Yes, thank you again for sharing. I'm sure that all of our members of the FCEP Medical uh, Student Government Council find this video very helpful. I did want to wrap up with just one last question. What is one message you would want individuals watching this video and prospective applicants to take away from your program?
Great question. Yeah, I want them to really um, take away the three things I mentioned in the beginning.
Mhm.
Uh, the, the three elements that really set us apart is we have an amazing clinical population here, which is a great place to learn. We have an environment with awesome faculty who are experts that really teach you in innovative and fun, engaging ways, and give you so many opportunities from a scholarly activity standpoint. And last, I would say it's our culture. We have a culture of support, and we have a culture that's magical. So, so if anyone has any questions and wants to learn more about our program, or maybe you're at a medical school that maybe there's not a lot of mentorship and not a lot of expertise in emergency medicine, we're here for you. We're happy to help you. Um, if you could share my email, I know you have it. Anyone can email me anytime. We'd love to have you rotate with us and learn more about us. But even if you are unable to rotate with us, I'm happy to personally meet with you.
Okay, yeah, perfect. Yeah, I will definitely in the description of this video include your contact information, the link to the website of your program, also maybe the social media handle and everything, and also make sure for students to know. I know we discussed it at the beginning, but in regards to maybe setting up an away rotation, to maybe email you, or also you said via Clinician Nexus was the site
Yes,
where you're accepting
got it.
applications. So I'll mention that as well for students.
Great, appreciate that.
Okay, well, that wraps up this interview. Thank you so much, Dr. Lebowitz, for taking the time and telling us all about your program.
No, my pleasure. Thank you for having me.
Of course.